Dermatology MCQs asked in UPSC exam 2019. Hello everyone, myself Dr. Maddineni Srinivas, dermatologist from Bharat. So let us begin the discussion without any further ado. So first MCQ is characteristic feature of Horner syndrome. You need to identify which one is the characteristic feature. And yes, partial ptosis, enophthalmos, constricted pupil and decreased sweating are the features of Horner syndrome. So next MCQ says, yes, this is the one. All of the following are clinical features of polycystic ovarian syndrome, which is now better called as PMOS, polyendocrine metabolic ovarian syndrome, except hirsutism, glucose intolerance, infertility. All of them can be associated but not menorrhagia. Please remember, it will be amenorrhea or oligomenorrhea but not menorrhagia associated with PMOS. Next MCQ says, which of the following is the most important complication in a patient with celiac disease who was previously doing well on a gluten-free diet and is now not responding to the gluten restriction. So what are the gluten-rich food? Barley, rye, oats and wheat. I hope you remember the mnemonic for that. So remember, the answer here is intestinal lymphoma. You should always suspect this very important complication if the patient who was responding previously to the gluten-free diet is now not responding to the diet. Next MCQ is, which are the following potential side effects of anti-tumor necrosis factor alpha therapies? All of them, infusion reactions, melanoma, T-cell lymphoma could be the potential side effects. So you must remember these adverse effects, very important. Celiac disease is associated, somehow celiac disease is very favorite question for the examiner, is associated with which of the following medical conditions? Yes, dermatitis herpetiformis, Turner syndrome, IgA deficiency. So but not diabetes mellitus type 2. So it will be 1, 3 and 4. So I hope you are enjoying these kind of videos. If you want more of these videos, please do hit the like button so that I will understand that students are actually getting some benefit out of these videos. Next, so there is a patient, hematopoietic stem cell transplantation is done. What do you think is the most possible infection early phase in this individual? So yes, it is herpes simplex, which you should keep in your mind, which is going to be associated in the early phase. Next one is, which of the following infections does not cause cold antibodies in immune hemolysis? So yes, malaria is not going to produce cold antibody immunohemolysis, whereas mycoplasma, syphilis, Epstein-Barr virus, all of them can be associated. Right. Next MCQ says, which of the following are associated with angular stomatitis and chelosis, dryness of the lips. Right. Yes, riboflavin, paradoxin, niacin, which are B2, B6, B3. So these vitamin deficiencies are associated with angular stomatitis, whereas thiamine deficiency is not associated with this. And yes, you should also remember one more important skin manifestation of the niacin B3 deficiency. It is called as pellagra. I hope you remember this. Can you remember what is the necklace seen in the pellagra patients and what are the 3Ds in the patients? If you can remember, put it in the comment section as your answer for the pellagra. I will tell the answer at the end. So next is this patient who is a 31-year young man presenting fever, weight loss, pain with swelling of the knee and low backache with stiffness. 3 weeks back he was treated for symptoms of urinary tract infection by the local practitioner. The joint aspirate is leukocyte rich, and this very important pathognomonic feature, multinucleated macrophages are seen in this patient. Urine culture is sterile. What is the most probable diagnosis? And yes, if you have thought of, these are also called as Reiter's cells. Characteristically seen in the Reiter syndrome, which was earlier name, but nowadays it is what is called as a reactive arthritis. So I hope you remember sexually acquired reactive arthritis and enterically acquired reactive arthritis. Most likely this patient is having SARA, sexually acquired reactive arthritis. Next is just a one-liner, interleukin 17A antibody. It is secukinumab. So that's it. There is no any explanation for this. Next MCQ is asking you about a clinical vignette where a 16-year-old boy, we can say pediatric age group, presenting with fever, diffuse maculopapular rash, and there is generalized cervical lymphadenopathy and hepatosplenomegaly. After intake of ampicillin, the rash worsened. Very important clues in this question are hepatosplenomegaly and ampicillin intake is worsening the rash. So what is the diagnosis? Very good. If you have thought of the infectious mononucleosis which is produced by the Epstein-Barr virus, which is associated with the 3 P's. What are the 3 P's? Patient will have the pyrexia, patients are going to have this posterior cervical lymphadenopathy, and also there is going to be this pharyngitis. All of these can also be seen in the bacterial sore throat, but what is the important differentiating feature? Yes, it is the hepatosplenomegaly and also this maculopapular rash, which are very characteristic of infectious mononucleosis, in which ampicillin or for that matter the aminopenicillins, amoxicillin or ampicillin are going to aggravate the skin rash. Right. Next one is just a one-liner. In normally innocuous stimuli, that is non-painful stimuli producing pain, what is it called as? It is very classically seen in the herpes zoster patients. Allodynia is the name of this condition. So next one is just a one-liner, NRTI, it is abacavir, there is no rocket science in this. Okay. So next one is just, this is also we can say one-liner, non-oncogenic HPV, you all know this very well, it is HPV 6 and 11. Next MCQ is from the paper 2, and yes, this is very important. Phases of wound healing you can remember with a simple trick: hyper, hematopoietic phase, inflammatory phase, proliferative phase, and the remodeling phase. Hyper. Next MCQ is yes, all of the following are risk factors associated with increased risk of wound infection except, so obesity, yes, it is an important risk factor. Jaundice and also cancer, but not hypertension. So answer is option B. Right. Next is related to surgery and dermatology integration. So patient is having lipodermatosclerosis, that is inverted champagne bottle appearance is there over the leg, and healed venous ulcer is there. Very important clue. As per the SEEP classification, the patient now is going to be categorized as C5. Please remember, dear students, if the examiner has only mentioned about lipodermatosclerosis, then it would have been C4B, but because healed ulcer is mentioned, now it will be C5 according to the SEEP classification. So next MCQ is regarding the Paget's disease. Remember, this is a malignant condition which will present as eczema-like condition, which is having erosion of the nipple. Obviously, it is Paget's disease of the nipple. Nipple biopsy is required to diagnose it properly. So 2, 3, 4 will be the correct. One is wrong. So next MCQ is regarding a 40-year female presenting with colicky abdominal pain associated with episodes of mild diarrhea for the last 6 months, accompanied by intermittent fever and weight loss. So till now there is no any dermatological sense, so there is some GI symptoms. Now there is multiple discharging sciences on perineal examination. So what is the most likely diagnosis for this patient? Yes, you have to think of Crohn's disease. Somehow examiner likes to ask about inflammatory bowel disease, ulcerative colitis and Crohn's disease. So you must be thorough with these topics, very important topics for UPSC examination. Right, next, yes, it is a split thickness skin graft. Which are the following parts are included? So remember, dear students, it's going to the epidermis and part of the dermis which form the split thickness skin graft. But if it was mentioned as epidermis and dermis completely, if they are included, then it will be full thickness skin graft. Okay. Next, this is also a very important topic, many times it was asked, which is not a characteristic clinical feature of bacterial vaginosis. Yes, the vaginal pH, which is more going towards alkaline side, it is associated. The whiff test, clue cells, all of them are part of bacterial vaginosis. Thick hairy discharge is a characteristic feature of the candidal vulvovaginitis, but not or monilial vaginitis. Somehow this topic is very important. You must definitely read about this while going for the examination. So that's it in this video, dear students. I hope this was helpful. If so, please do that like button, and also the answer for the question which I asked in the video was pellagra, vitamin B3 deficiency. It is going to produce this 3 Ds, which are the photodermatitis, diarrhea and dementia, and the necklace is called as Castle's necklace. So if you have answered it right, awesome, very good. So If you are not yet subscribed, please do subscribe to my channel, and we'll meet again in the next video with the other video. So till then, happy learning. Bye bye. We'll meet again soon.